Hey everyone, welcome back to another episode of 6 Degrees of Associations. I'm your host, Lucas McCann. I am borrowing an intro from another interviewer of this gentleman who said if we were to list out all the accolades of his, that would be the whole show. So we're cutting it short, and I'm going to introduce Dr. Accius, President and CEO of CHC, Creating Healthier Communities. Welcome to the show.
Thank you so much, Lucas. I wasn't prepared for that comment, but I'm deeply humbled and deeply honored to be part of the conversation with you today.
Well, it's true, and so the honor is mine. As I do often, I want to turn the microphone over to you and tell us a little bit about your current role, where you are in our association nonprofit community, and then we'll backtrack because I'd like to hear a little bit about how you found it, some time ago.
Absolutely, Lucas. So first of all, I am deeply honored to be having this conversation. We, particularly in the United States, face a huge healthcare crisis. So much so that Deloitte mentioned that it's costing us over $320 billion a year. And if we do absolutely nothing, it will surpass $1 trillion by 2040. So that this crisis in terms of healthcare and the inequities in our system means that it's stifling economic growth, which impacts all of us. So that's a way of saying that for CHC at Creating Healthier Communities, we're an organization that's been around for nearly 70 years, dedicated to addressing the barriers to health. So much of your health is outside of the healthcare medical system. It's where you live, where you work, where you play, where you pray. All of those social drivers, education, access to medical care, all impacts your health. And what we're seeing across the country is that there's huge differences in terms of how long and frankly how well someone lives solely based off where they actually live. So with Creating Healthier Communities, we're on a mission, and we want to encourage you and your viewers to actually join us on that, because we believe, as our vision says, that every person in every community should have an opportunity to live their healthiest life. And we do that through community engagement. We do that through partnerships. We do that through addressing those barriers at the community level that actually impacts people's ability to ensure that their life's aspirations are fully realized and that they can thrive.
The work that you all do really expounds globally and beyond generations that we will be around to experience. So I personally am glad we're having the conversation as well. And I want to jump into in a minute what makes that healthier community, kind of how are we measuring this, what leads to communities that we would consider to be non-healthy. But before we do that, I often ask, let's jump back. How did you find this world? How did you come into associations and nonprofits and this service community?
The late Elijah Cummings would ask each person who worked for him, what fuels your soul? And I think that's a critical question that we each, at some point in our journey in life, need to ask ourselves. And another way to kind of think about it is like, what's your sense of why? Because if you know your sense of why, your what has more impact. So for me, my sense of why is really thinking about how do we ensure that every single person has an opportunity to live their healthiest life? How do we remove a lot of these barriers that actually limits that or stifles economic growth? So that's been my core mission. From a very young age, I saw the differences in access and the differences in opportunity and the differences in treatment. And I also had an opportunity to see the potential implications of that as people lived longer and got older, and have been committed to really ensuring that we address those differences, because every single person should have the same number of years to grow old with their spouses or partners, to watch their kids get older, to watch their grandkids grow up.
Absolutely. Yeah, I feel like growing up, healthy was just sort of like how you physically looked and felt, day to day. That was what healthy looked like. But it's really evolved and changed, and there's so many aspects that lead to a healthy life, and part of, as you said, is that healthy community. And so tell us a little bit about, what does it mean? What does a healthy community look like? Some of our listeners and viewers may think I'm part of a healthy community, but may not realize that there's aspects of that they're missing out on that could really increase the quality of their life and as you said, the length of life.
It's important to know that even in communities that have tremendous resources, that there's always room to improve. So when you think about a healthy community, it really talks about what are the opportunities in terms of access to a range of services and supports to ensure that you have the resources so you can actually live and live well.
Hmm.
That means access to high quality education, means ensuring that there's different modes of transportation. It means that there are walkable streets and that there are parks and options that allows you to engage in your community. It means the ability to be socially and civically engaged, the opportunity to have economic mobility.
Hmm.
Uh, it means having a safe community as well. It also means ensuring that the environment in terms of pollution and things of that nature are also addressed. So when we talk about a healthier community, we're saying that that these communities are where individuals have the freedom, if you will, from some of these negative outcomes that impacts their health. Whether that is the need to have access to a range of medical services, the need to have access to high quality education, the need to ensure that there's great collaboration taking place between different sectors at a local level. So when we think about health, we're saying that all of those factors actually impacts your health and it impacts the health of your community. So for us as an organization, we touch about 5,000 nonprofits on an annual basis.
Hmm.
In addition to touching 5,000 and engaging with about 5,000 nonprofits on an annual basis, we also engage with corporate companies. We have more than 61 global companies, and we're in communities at the local level. So through the opportunity to work with nonprofits, the opportunity to work with companies in the private sector, as well as to work with communities, we are able to leverage the sectors towards a focus on addressing the health and the health care of the communities in which we're in.
It's amazing. Can you get a little bit more specific for us,
Mhm.
Dr. Estes? So give us some examples, because I love that you work with nonprofits, and I think they're just the launch pad to reaching the
Mhm.
world in a lot of ways, which is why one of my whys working within this community is there's a bunch of small businesses that change the world. And so tell us a little bit more, again, day to day, tactically, how you would jump in and help these organizations.
Yeah. So that's an excellent question, Lucas. If you think about it, for us as an organization, we're community centric, it's in our name,
Hmm.
and we're community informed. We believe very strongly through partnerships that those who are closest to the challenges in the community are the experts in terms of solving those potential challenges. So for us, as tactically, part of what our approach is to engage communities by first taking the time to actively listen to them,
Hmm.
not going into a community, but being invited into a community through our partnerships. Spending time to understand exactly what is the ecosystem, what are the assets of a community. Every community, even communities that have limited resources, actually have tremendous assets and they actually have some innovations that they have taken place. So from our vantage point is really understanding what are the assets, what are the strengths, what's the resilience of the community, what's the readiness of the community, as well as the nonprofit organizations at the community level. And a lot of that is done through focus groups, interviews, discussions, listening sessions. The other aspect of that too is also doing a landscape assessment, understanding not only where the strengths are, but where might there be some potential gaps.
Yeah.
And then who are the traditional and untraditional partners? Who are the anchored institutions at the community level? What's the readiness in terms of trust of those institutions? And then where we help to come in is serving as a connector and a convener based off the foundation that we've just laid out. So we work very close with our nonprofit partners in the community level to both ensure that there's capacity enhancing support.
Hmm.
That way, that any initiative that we are undergoing is sustainable long term, as well as capacity building support. And Lucas, just to get a little bit more specific in terms of how does this show up, I always share with you one of our initiatives. So there's a huge maternal health crisis in this country. And part of that maternal health crisis is the fact that Black birthing individuals are 3 times more likely to experience negative outcomes. Through this initiative, we've been able to address the maternal health crisis through a program called the Black Birthing Initiative. We're engaging more than 400 Black birthing individuals with case management, advocacy support, resources, education, doula support. And we've seen significant health outcomes as a result. The national average for a Black woman in this country given a full term birth is 54%. The Black birthing individuals through our BBI initiative have the average of those individuals participating in the Black Birth Initiative is 71%, so above the national average because of the wraparound services that we've been actually able to do. Because of the work that we've been doing with our partners in several different communities across the country to address the maternal health crisis, we've seen a significant savings of $2.2 million so far through
Wow.
this initiative, which
Wow.
is only 18 months. So when you take into account partnerships and you take into account the community and ensuring that the community is at the center and you provide the wraparound services, you can actually achieve significant health outcomes. We've seen, check this out, Lucas, uh, increases in food security, increases in housing stability,
Wow.
as well as decreases in anxiety and depression among the participants in just 18 months.
Yeah, Dr. Isis, tell us a little bit about what are the barriers as you're going into these communities with the mission of making them healthier individually and globally within the communities that you often run into that become the largest hurdles?
Thank you for that question, Lucas. I think that there's innovations taking place across communities across the country, and we have an opportunity to help amplify, identify, and bring those innovations to scale. I think part of the opportunity for us collectively, particularly in the association world, is to really take a few minutes to kind of challenge our own assumptions and the lens in which we view potential challenges facing communities. We like to say that at CHC, we like to be invited into a community, and oftentimes that invitation is through a partnership with an organization that's currently in the community. We believe that trust is so critically important, and that we have to move at the speed of trust in terms of engaging communities because want to ensure that they are in the driver's seat of any solutions that are created or co-created.
Mm-hmm.
The other aspect of that too is the fact that one of the biggest challenges I think that face any community for that matter is the ability to think about the collaboration across different organizations at the local level. So many organizations, there are so many nonprofits who are doing amazing work. And if we just could think about how we collaborate and bring those services together that's centered around the needs of the community in a very concentrated effort,
Mm-hmm.
that would be significantly helpful for both the community as well as for the people that we collectively serve. The last thing I would say is the fact that oftentimes I've heard individuals say it's so difficult to reach certain populations. And my reaction to that is the fact that it's not that there's no such thing as a hard to reach population. They're just hardly reached.
Yeah.
And that just means that we have to think very creatively about meeting people where they are. And not just meeting people where they are, but also taking the time to understand their needs, their preferences, and that they are seen and heard.
Absolutely. You know, one of the questions I often ask guests is to tell us about a mistake that they've made that they really learned from. And I've found guests are pretty open to sharing mistakes. I'm not going to ask you that question because I know that there's a very great TED Talk out there with you in it on stage talking about that mistake. So I'm going to encourage the guests to go look at that. Instead, I'd like you to sort of pat yourself on the back. I'd like to hear about a success story with CHC where you've gone in and made a real impact, either through partnership or direct in a community. And what did the outcome of like that? Did that look like one that stands out to you that you're really proud of?
I think that there's a couple of things that comes to mind for me. One is the fact that I think that as a society, frankly, we tend to glamorize success, not realizing that success is a combination of many mistakes that has led to it, right?
Yeah.
So I'm really humbled by that. I think that as a leader, it's critically important um, to lead with curiosity and to lead with a sense of humility. And that is something that I strive to do each and every day. So part of my success, if you will, has been really taking the time to really understand some of my mistakes along the way. And for me, that has been really um, trying to be as best of an active listener as I can be. And I know I'm not answering your question, but I'm about to answer your question.
It's actually harder than the mistake question I found. It's interesting. Over
Yeah,
time, I found it's easier sometimes to talk about our mistakes if we're
that
sure
it
enough
is.
than it is to talk about. So I know I put you on the spot a little bit, but I'm so intrigued by your work and within these communities. I'm I'm giddy to hear a success because
Yeah.
I just enjoy it so much.
I think for me, the success has been really, as an organization, trying to find ways in which we could get closer to the people that we actually serve,
Hmm.
and seeing that manifest itself in so many different ways. And I'll give you a perfect example of that. One of my favorite quotes is from Brian Stevenson. And I don't know if you know Brian or know any of his work,
Hmm.
but from the Equal Justice Initiative, and he's the author of Just Mercy. But he basically has in the books a quote that I just absolutely love. It says that you cannot be an effective problem solver from a distance. There are nuances and details you will miss unless you get close. So the success for me, what fuels my soul each and every day, is whenever I have an opportunity to be invited into a community and to be invited at their table, and frankly, just to listen,
Hmm.
just to become a student in their world,
Hmm.
and to be able to understand how complex the work that we're doing is, but how rewarding it can be when the system is actually working in a way that really aligns to the needs of the individuals that we serve. And I know that sounds much more aspirational than the question that you posed to me, but for me, success is a combination of aligning the needs of the communities and the nonprofits that we serve in a way that actually helps to manifest the vision of our organization, which is the fact that every person,
Hmm.
regardless of zip code, has an opportunity to live that healthiest life.
Yeah, absolutely. I've heard that described as it's difficult to solve a puzzle if
Mhm.
you're not at the table flipping over the pieces and really looking at them, right? I mean,
I love that.
you ever try to solve a an actual jigsaw puzzle through a through a telescope? It's really difficult to do.
Yeah, I
And so you
absolutely
have
love
to put your hands on the pieces. You have to pick them up. You have to look at them. You have to understand how they fit into the greater picture in order to be really able to solve it. So I couldn't agree more. One of the things I think healthy historically, again, is physical health, and more recently in the past few decades, the mental health of the
it.
community has become more apparent, more um, maybe just more uncovered
Hmm.
and more talked about. Which tell us a little bit about how much of a factor. I mean, do you weigh them physical, mental? How do you approach the two? If I were crudely to divide the two areas of health into those categories, how much of a factor is health in the
I
mental
think,
sense?
I think, and thank you for that question, Lucas. I think that your mental health is just as equally important as your physical and emotional health and your spiritual health. I think that we're a combination of all of those different elements. And to your point, I think that we have collectively experienced a traumatic, once in a lifetime, hopefully once in a lifetime, pandemic.
Mm-hmm.
And I think, in addition to that, we've also collectively have experienced the trauma of racial injustice, the range of other issues that has taken place over the last couple of years.
Mm-hmm.
Then you add on the isolation elements of this. And then you also add on the fact that even though we may have been on the same boat, clearly the data suggests that we may have been on the experiencing the same storms. The data suggests that we might have not all been on the same boat, right? So you have this double, triple whammy of issues
Yeah.
that we've undergone that we have to take into account the mental health elements of this as we move forward. So, in other words, is the fact that we're seeing tremendous, significant trauma
Mm-hmm.
across our communities at all levels, at all ages,
Yeah. Yeah.
and that we need to take the time to focus on mental health, to talk about mental health, to examine how this might manifest itself in our workforce, in our
Mm-hmm.
workplace, and then really think how collectively we can start to address the mental health crisis that we face. The other aspect of that too is the fact that in many ways we've lost community,
Mm-hmm.
which is critically important to your mental health and well-being as you age. So
Absolutely.
we have an opportunity here as individual leaders, as employers, as organizations, to say, what is our strategy to ensuring that our workforce is psychologically safe? What is the
Mhm.
strategy to ensuring that we have resources to support the mental health needs of those who work with us and those who work for us? What are we doing to check in with ourselves? Are we taking some breaks throughout the day, going
Yeah.
for a walk, getting out for fresh air, calling a friend, having a conversation with your therapist?
Yeah.
This is such a huge issue, and
Absolutely.
it requires a multi-pronged approach.
And all of those elements, in in my mind, are what make up the community, right? All of those pieces are the boat. And I just want to lean
Mhm.
into the metaphor further because I think it's brilliant. Is if isolation is the storm, and it is universal in that sense, um, it's really the community or the boat that you're in that impacts how it impacts you, right?
That
If
is
you're in the
exactly.
little boat, and isolation is what it is. If you call it a standard, because it in a sense is, it's really how much support do you have in where you are in the ocean,
That's exactly.
that will decide, hey, am I safe from this isolation, from this storm? Do I have all the support? Am I on the ocean liner, or am I in the dinghy?
Mm-hmm.
And it makes a
That's
big
exactly right.
difference.
It makes a huge difference.
Well, coming off of that, I want to do a couple of questions that are a little bit lighter.
Okay.
These are common questions that I typically throw at the guests, and um, here we go. So one is, what is something that you really look forward to every year? I mean, it's a staple on your calendar, um, and it's always there. It's the first thing you put on the calendar, January 1st or even before.
Oh, that's an excellent question. For me, it's my vacation schedule for the year. I've become more and more attuned to that self care and the need to to identify what brings me joy.
Yeah.
Lucas, for me and for your viewers, I think it's important to have your joy list. Things that
Mhm.
actually bring you joy that you try to do at least once a day. Take one of those things from that list and try to do once a day. For me, it might be getting a cup of coffee. But to answer your question, is actually planning out my, when am I going to, when am I going to take vacations throughout the year, and just kind of making sure those times are blocked,
Yeah, that's great.
and it is critically important for me.
It's right in the vein of sort of paying yourself first. It's, build out the time for yourself and let the rest of it build around it. I love it.
That's exactly right. That's
What
exactly right.
what is something, Dr. Accius, that we couldn't find out about you online or on your resume?
I'm an introvert.
Oh yeah, we wouldn't know that online. That's fair.
I'm an introvert. Is when I'm an avid reader. So if had a conversation, I'll be throwing quotes left and right from different authors and
I've
different
heard a
books.
few, and they're great. They're wonderful. Thank
Um,
you for those.
yeah.
That's excellent. Well, I really appreciated the time today. I always have the unfortunate measure of bringing our show to a close, but as I always do, I'd love to know, is there somebody in your network, Dr. Axios, that you believe our audience would benefit from hearing from?
Absolutely, Lucas. I would highly recommend Raul Andrews Jr., who is the president of the American Psychiatric Association Foundation. To your point about mental health, addressing the mental stigma in our country, addressing the social isolation, I think he would be an amazing guest.
Well, thank you for that, and thank you again for the time. I know you're busy. I appreciate you taking some time out to talk to our audience and myself. It was a wonderful conversation. If you're up for a round two, I am as well. So,
I am always up for a round two, Lucas.
excellent. Thank you very much.
Thank you.